Привет, comrades. I'm just kidding. I'm not speaking Russian, although that'd be pretty freaking cool if I could, because it's a really hard language to learn. So, as promised, I told you I would update you after I got my second vaccination. So, a lot of people were kind of hesitant about the second vaccination, like the wait and see, that's going to be the bad one. So, I am about 24 hours out now from my second COVID-19 vaccine. I have gotten the second of the Pfizer vaccine series, and just to show you, this is my card. So you can see I got the first on the 18th and the second on the 9th at Geisinger Jersey Shore Hospital. And just to verify kind of where we are, let's see if this will focus. Focus. Okay, maybe not. Well, anyway, the date is now the 10th, so I am about 24 hours out. So kind of reiterate where I was on the first shot. The first shot, I basically had some sore arm tenderness for about 18 hours. And that was about it, controlled with ibuprofen. So I'm silly and forgot to rotate arms, so I did unfortunately get the same arm this time. Well, I did bleed a little bit this time, whereas last time I did not. So I did have that. I did bleed a little bit. So the actual tenderness has been there about 24 hours this time, and persisted through the ibuprofen. So I did take 800 of ibuprofen, probably about 2 times since I've gotten my shot. I didn't bother with Tylenol because Tylenol, in my opinion, just doesn't really work for me. But it's not like anything that I can't move. Actually, it feels better now that I've gotten a bath. So yeah, not real bad. The actual site itself, you really can't even tell. And this is just my normal blotchiness. I have keratinosis pilaris, and I just have normal dry skin. So don't let that deter you. That's actually pretty normal for me. And actually, I can show you my other arm that I just get blotchy like that. So anyway, really, really easy process. I got my vaccine as scheduled. I'm actually a day over the 21 days. So Pfizer has like a 4-day window, one way either direction. And so I was 1 day over just because I had to work. And per the usual standards, I waited the 15 minutes and really nothing. I just sat there and talked to a friend the entire time. So really nothing there. And I had a couple things I really wanted to talk about. So if you were just interested in how I'm doing, that's about it. I have no headache, no really anything at this point at 24 hours. I will have a second video at 48, and I will have 1 week out, and then I'll do another one probably about a month later. So if you're really not interested in anything else, you can turn the video off now. But there are some topics that I do want to talk about. Since you're here, we might as well talk about them. Some things I'm going to talk about are the Florida doctor that passed away after his vaccination, the nurse who fainted on camera after getting her vaccination, positive tests after vaccinations, talk a little bit about side effects and adverse effects. Ooh, this autofocus is really driving me nuts. Talk about adverse effects in vaccinations and some of the reports that are going on with vaccinations. So that's a little bit what I'm going to talk about. If you're interested, hang around. If you're not, nice seeing you. Do svidaniya. So I will have another update tomorrow. So if you're interested, pop on. So basically, I just kind of want to talk about some of the conspiracy theories that are surrounding these vaccinations. So some of the things I've been popping up are obviously that people are going to grow 2 heads, people are getting microchips, people are going to speak Russian. And some of them seem really silly, and they're fun to make memes about. As you saw when I started the video, I started with the whole Russian language. And, they're really fun for people that are based in kind of reality to kind of pick at and, make fun of. However, there are actually people out there that believe these things. I just want to put this out there for anyone who might be, a little fearful that there's some kind of RFID technology, there is any kind of truth in tampering with these vaccinations that is not founded in reality. There really just is not. And I really encourage you guys to please, look to reliable sources that are not QAnon, they are not unchecked forums of people that just are not founded in reality. There's a lot of people out there that do have actual mental health issues, that schizophrenia, that are founding in delusions, that are out there making these claims. And they may seem very articulate, very believable, but that does not mean that they are not mentally ill. So I really encourage you guys to please, please, please go out and look for good factual information that is based in science and logic, not on emotion. And if you have questions, reach out and ask. If something doesn't seem right, doesn't smell right, doesn't feel right, don't share it, because you may be scaring other people, and misinformation is very, very dangerous. Some of the things I'm seeing online, it seems so real, but it's just not, guys. It's really not. And misinformation on the internet may seem very harmless, but just because it's on the internet doesn't make it true. Misinformation has real life repercussions, and we have to understand our part in controlling misinformation. We all have responsibility to make sure that we are not the one contributing to somebody else's misfortune. So please take responsibility in what you share. Please fact check it. And I know that this is a big thing about who's fact checking the fact checkers, but peer review is a thing. There are a lot of organizations out there that have a seal at the bottom of most medical websites. You can look at the very, very bottom, and it will show that they are part of an organization that upholds medical ethics and validity, credibility, and so forth. That means that they are held to higher standards. So I encourage you guys to go out and whatever your fields that you're looking in, whether it be politics, it be science, it be medicine, whatever it is, please look at who fact checks them, because generally they will have a seal of excellence at the bottom of their websites, and you can go ahead and look for those, and then you will know that at least there is some fact in those websites. So go ahead and look into those in your designated fields. That being said, I want to talk about the physician who passed away in Florida. Now, this has been on the headlines now and is sensational, and it's scary. I mean, you hear about a physician who 3 days after he gets, and this is for people who haven't heard about it, but, if you haven't heard about it, first I wanted to tell you, don't panic. So there was a physician who received the Pfizer vaccine on December 18th. 56-year-old man, very good health. He was, I think, an obstetrician or a gynecologist. He got his Pfizer vaccine, and then within 3 days began to show symptoms of what's called thrombocytopenia. So my medical friends and folks, you probably have a general understanding of thrombocytopenia. So just bear with me while I quick talk to people who don't have this medical knowledge. Thrombocytopenia is generally where you have problems with your platelets. You have low platelet counts, and platelets are what help us form clots. Clotting is what helps keep us from losing all of our blood, and outside, inside, it keeps our blood circulating through our vessels the way it needs to. And when you have thrombocytopenia, for whatever reason, your clotting mechanisms are not working because you do not have the platelets that you need. And there's a lot of reasons that you can have this. So there is sometimes an immune component to it, but there are other reasons for this. So without getting into a huge pathophysiology lecture, it can be genetic, and you wouldn't know that unless you run a genetic test. You can have autoimmune diseases such as lupus, cancers like leukemia, different kind of pharmaceuticals and such, like different drugs can do that. Sepsis can cause this, such as like if you had pneumonias or unchecked infections that are not treated. Without speculating, why this particular man got it, what if theoretically he had some kind of infection that went unchecked even before his vaccination. H. pylori infections. H. pylori is a bacteria that occurs naturally in the gut, but if it goes unchecked, you can certainly get a thrombocytopenia from that. So there could be a lot of different reasons why this poor gentleman went into thrombocytopenia. So his story continues is that he, I think about 2 weeks after he was diagnosed with thrombocytopenia, had a hemorrhagic stroke. Essentially, he bled into his brain and passed away. This is all very, very tragic, and it's very easy to assume by the headlines in the news, if you don't actually read the paper, that, 1 + 1 = 2. And I want people to remember in science and medicine, correlation does not equal causation. So it happened around the time that he got his vaccination, but that does not necessarily mean that that is because of his vaccination. Now, we'll know probably within 2 weeks from his autopsy and his medical reports, maybe a more definitive cause. However, he did not. Right now it's not pointing to be related to the vaccination. There's been nothing in any of the other in the research. There's really no traditional rationales in vaccinations that cause thrombocytopenia. Even with when you think about the data that we have now, I think up to date now we have 24 million vaccinations that have been administered worldwide. 6 million or so up to date right now. It was the last time I checked all the data. We have 6 million just here in the United States, 24 million worldwide of the various different drug companies. So I really encourage you not to fear one account. It's scary, yes, but one account, it's too soon to say. So do not let that one account terrify you when it could be anything else but the vaccine. This is the same thing I talked about with Bell's palsy. Bell's palsy, in the occurrence of people that were in the vaccine trials, was actually a lower occurrence than in the natural population at large. So just because it was occurring during the vaccination trials, you have to report it in vaccination trials because it happened during the vaccination trials. But just because it happened then doesn't mean it was caused by the vaccine. So it's too soon to say. I wouldn't panic because of that, but you guys know the media, headlines that are flashy mean clicks, and clicks equal money. So don't panic yet. And I really encourage you guys not to share that stuff quite yet, because again, it's too soon to say. And if anything, it's going to scare people, and that's not founded in fact. Wait until we get the data. You can certainly talk about it. I'm not saying put a gag order on you, and I'm not saying to censor yourselves. But if you're going to talk about it, tell the whole story. Don't share the headline without putting context to this. Make sure you're not just sharing the article for the headline. Make sure you're reading the article. You're going out and you're understanding what the article is saying. Okay, thrombocytopenia has a lot of different causes. So please make sure you're arming yourselves with information, not just allowing the media to weaponize you with a headline that's flashy. Because that in itself is fear-mongering, the very thing that people don't like. So that being said, fear-mongering. Okay, so who's seen the video of the nurse who fainted shortly after she got her shot? That's terrifying, right? So when I got the Gardasil shot as a kid, I'm pretty sure I fainted because it was horrible. It was painful. That being said, this particular video of this nurse fainting after the COVID vaccine scared a lot of people. And she came out after the fact and said, "I'm fine." But nobody wanted to watch that video. They wanted to share the one of her fainting. So let me talk a little bit about that particular nurse. That particular nurse has a syndrome called this vasovagal syncope. What is vasovagal syncope? Who is familiar with your fight or flight response? Your fight or flight response is basically, long story short, your body's ability to amp up and do the thing. It's like a surge of hormones stimulated by a bunch of different chemicals and different vessels and such. They all kind of come together and give you that adrenaline. Now, like all things in life, there is a balance. You have fight or flight and rest and digest. So when you're done when you don't need to do the thing anymore and you just need to chill, you have this particular set of hormones and different receptors that basically help you chill. And that is called your parasympathetic system, particularly known as your vagal nerve. Now, for some people, your vagal nerve is very, very sensitive. This particular nurse basically came out and said her vagal nerve is very sensitive to pain. Anytime she gets any pain, she faints. She specifically said that she probably faints once a day, probably more, anytime she hurts herself. Hangnail, faints. So, that being said, I really think she was probably the worst candidate to put on TV getting a COVID vaccine that people are already terrified of. But that's Monday morning quarterbacking. The story here is that that is once again, media sensationalized kind of thing. But people don't look at the whole story. They kind of fixate on one small component. So she's perfectly fine. But it's really scary when you see somebody like keel over and say, yeah, I'm dizzy, but she's fine. That's normal baseline for her. Just like when I talked to you guys the other week, and I said, I'm having a little bit of like problems breathing, but no, don't panic, because that's been there before, my shot. We have to take things in terms of context. And this comes back to that physician who, he could have had something going on before the shot. And, once his immune system kicked in, that's it. So context, guys. The media is not going to do that for you. They want your clicks. They want your money. So context. That being said, let's talk about the actual vaccine itself. Let's talk about the research. This might put you at ease a little bit. Okay, so we said 24 million shots have been administered. That's fantastic, but that is too slow. Herd immunity needs to be at least 60 or 70% for us to do any good. Now, hopefully we'll get a little quicker. We're getting through the high-risk categories, and I will discuss that last. But let's talk about the adverse effects that are being reported. Now, I just talked about the media. I do not get my data from the media. I read the headlines and I read the stories just because I really just want to know what people are seeing. That way I'm kind of armed with, how to counter those arguments. I get a lot of my data from peer-reviewed journals, and I also read a lot of the reports that the government put out, as well as international governments. I don't just stick with our governments because, I feel like when I start, trying to talk to people, they are going to accuse me of being brainwashed by the government, which, no, I am not. But we have here in the United States a vaccine injury adverse effect reporting system. It's actually called VAERS, VAERS. Everybody can look this up. It is not a secret. It is a little tricky to learn how to use. There is an instruction manual on the CDC's website on how to read this. So I encourage anybody who's curious to go look at it. VAERS, VAERS. It is the Vaccine Adverse Effect Reporting System. So if you are really curious about what data is out there, go out and look. Don't look for the media. Don't listen to me. I don't know what I'm talking about. But, go out and look. So let's talk about where we're at right now. So since in the time period between December 14th and the 23rd, now, delay. I want to make this statement really clear real quick. There are delays in reporting. So you're not going to have the most immediate data right now. There's always going to be delays in reporting for COVID, vaccines, everything. The government's slow. We know that. Plus, we just came out of a holiday season, so we're not going to see all the reports right away. Between December 14th and the 23rd-ish, so that's about a week period, there were 1,893,360 vaccines given in the United States. With that, there were 21 cases of, allergic reactions. So that could mean anything from hives, severe allergic reactions, enough that they need treatment. So severe hives, breathing difficulty, 21 anaphylaxis. So no, I misspoke. There were 21 documented cases of anaphylaxis in that almost 1,900,000 cases. So at that point, if you kind of break that down a little bit easier numbers, there were 11.1 per 1 million. So 11 people in 1 million would get anaphylaxis. And to make that a little bit more palatable, of that 21 cases, 17 of them had a documented history of reactions, and 7 had a documented history of anaphylaxis. Okay, so a large percentage of those people were known to have problems. They weren't just spontaneous. It wasn't poof, I have a reaction. I mean, there were a few cases of poof, I have a reaction. Even better yet, 71% of those cases had their reaction within 15 minutes. Those that were not in the 15 minutes, a large percentage had them within 15 to 30 minutes. So probably as they were walking out, still within the area, milling around, So that's really good, 15 to 30 minutes, so it was very immediate. And then I think it was a small portion, like 3 to 5% had a greater than 30 minutes. There were no deaths. That's great. That's awesome. Anaphylaxis is one of those things that we can treat. We use a combination pre-hospitally of epinephrine, Benadryl, Solumedrol, fluids, oxygen, albuterol. It is incredibly easy to treat. The standard administration protocol for vaccines is that when we get the vaccine, you sit for 15 minutes. So bring a book, bring a friend. Well, no, don't bring a friend. We're social distancing. Don't listen to me. I don't know what I'm talking about. Bring a book, bring a podcast, bring a phone to take a selfie of yourself and post it, share, tell all your friends, share, I don't know, whatever the YouTubers are saying. But, for 15 minutes, you have trained professionals with all of the tools they need to intervene if you are having a reaction. So when you consider that 71% of the allergic reactions that happened in the first 15 minutes, and you get to hang out for 15 minutes, it's incredibly safe, and there's nobody who's died yet. And I premise by saying that we do not know that doctor who died because of this. So don't at me on that. But when you consider when you compare this, okay, so no deaths from the vaccine that are officially attributed yet, and you think of the grand scheme of COVID. So to date, I think as of January 1st, there has been 20 million cases. That is a lot of cases. And 349,246 have died. Versus 0. And then you think about it, okay, it doesn't affect me. I'm young, maybe I'll get a mild case. And then you look at the research that's coming out, and 60 to 80% of cases, not severe, not moderate cases, mild, moderate, severe, are coming out with long hauler effects or long-term effects or permanent damage. I would hope that you guys love your bodies and love yourselves and love your family and friends enough to not say that I'm okay with having a mild flu, not my words, that can put me on an inhaler for the rest of my life. It sucks. I'm speaking from personal experience. It sucks. I miss being able to walk up the stairs in the middle of the winter and not get winded. So I'm not trying to shame you. I want you to be very well aware of the risks and benefits of both. So mRNA technology is not going to change your DNA. There are very, very mildly small risks. Yeah, I agree. We don't know how long this vaccine's going to last. But as children, we take boosters through our whole lives for certain vaccines. We get flu vaccines every year. Hep B boosters, our Tdap is every 10 years because whooping cough, isn't guaranteed from when we're children. My eyes have seen enough people who are in my community, probably normal people, farmers, people that probably work as truckers, people that, just normal people that I've probably run into the grocery store, never would have thought twice about. But until you truly appreciate somebody staring at you in a panic, not being able to sedate people well enough that you have to paralyze them and then help try to resedate them. And until you've had somebody who's been paralyzed and then you're trying to sedate them. Guys, I'm not trying to guilt you. I'm really not. This is a personal body autonomy choice. But we've got to take this seriously because life, unfortunately, is not going to go back to normal until we can kind of slow the spread down. And, one of the ways we can do that is by limiting our symptomology and trying to take a proactive role in this. Essentially what you're getting in your vaccines is a small piece of fat. I know, it's not palatable. So the little spike on the mRNA vaccine is a fat, basically it's called a lipid protein. It's a little piece of fat. So as disgusting as that really sounds, but it doesn't stay in your body. There's literally less chemicals and pieces than probably the soda you just drank, your sweetener you used in your coffee, the fast food you ate last week, whatever preservatives you were using in your detergent. Those things in our lives, the air we breathe, the water we drink, those things aren't good for us either. But we don't draw our line here when, you know, our family and our friends are dying, our economy is shutting down. So I'm going to stop with the whole guilt treatment because I want to finish with why it's taking so long for the vaccines to get out. Okay, so, oh, and one other thing too, I forgot to mention. Reports of nurses that, or I'm sorry, not nurses, people that are getting vaccinated and still coming up positive. With vaccinations, they are not like you get a shot and you're immediately immune. Your body takes time to learn things. So think about the first time you were trying to learn something. It wasn't like I suddenly know something after seeing it once. Now there are savants, don't get me wrong. But when you are learning something, you want to try to repeat it over and over and over again. Over a period of time. Your body is making like copies of things inside of you, and that takes a period of time. It's learning, it's doing repetition. So when you get a shot, it can sometimes take probably 10 to 14 days-ish, don't quote me on that, to make a real good immunity to something. So when you get these shot, it can take, I think, about between this 2 shots, you can gain like a 50%-ish something immunity for, I think Pfizer. Don't quote me on Moderna, but for Pfizer, they're saying maybe like a 50 to 56% immunity. By the time it comes around to the second shot, you should have like an 81 to 86% immunity. After your second vaccine with Pfizer, you should have like a 96 or 98% immunity after like 2 weeks, 3 weeks after the second shot. Which is really great. But again, right immediately after shot, your body still doesn't know. It's still learning in the learning process. That's like asking your body to go to school and then graduate the next day. It just doesn't work. So when you hear of people becoming positive after they've got the vaccine, it's not that it doesn't work. It's probably that they had already been exposed prior to the vaccine and weren't yet expressing symptoms. I mean, even think about this yourself. The recommendations for testing are still like 3 to 5 days out. So until you show symptoms or it's been however long after an exposure, they still ask you to wait. So these nurses and doctors and healthcare providers in general, and I keep saying nurses, so I apologize to my EMS personnel friends. It could be so long. So it doesn't mean that it doesn't work. It just means that they were either positive before or they became positive immediately after getting their vaccine. Okay, so that. I'm going to finish with the triage system and the tier system. So you are probably hearing about the tier system and wondering, why am I, an elderly person in the community, a person with immunocompromise, not getting these vaccinations, and here is my grocery store attendant who is a teenager or a housekeeper who is, 20-some, and they're healthy. Why are they getting it before me? I really want to explain about this real quick. So the tier structure, at least in Pennsylvania, is trying to put people that are considered high risk. And it's not that elderly people or people immunocompromised are not high risk. It is because they are first trying to protect infrastructure. And as healthcare providers, we are in the pit with patients who are actively positive. So for us to be able to continue to save lives and make sure that people that are sick can get better and continue to save lives, we need to make sure that healthcare providers are not going down. We have lost more nurses in this pandemic than had died in World War II. We have had lost so many healthcare providers this year, and it is insane. And a lot of it, yes, came from the community, but a lot of it came from increased viral loads from being exposed to patients. So healthcare providers were prioritized in order to try to make sure that we can continue to have a workforce. So yes, we're young. A lot of us are healthy, but emergency departments, ICUs that provide care to positive COVID patients, EMS providers who are working in confined spaces for large periods of time with minimal ventilation, stuff like that. We were prioritized, and it's not that we are more important. It's just, unfortunately, if you become sick and there's no one to take care of you, you might die, or in some cases you will die. So having all the ventilators in the world mean nothing if you have no one there to run them. So that being said, hospitals also run with housekeeping. If you have dirty rooms that are contaminated, people that were not sick with COVID can become sick with COVID, as well as C. difficile, MRSA, a bunch of other what we call nosocomial infections that could kill you. And you think about infrastructure. So the world will shut down if we cannot maintain a society. So please be kind. Be kind to people who, frontline workers, yes, they're young, but their jobs have been thankless. They are doing their best to try to keep people masked, and they're being, like young kids, are being assaulted by angry people who all they did was ask to be masked. And they're making minimum wage. I know it's angry. I know you're angry. I know. And I know you're scared, and I know you want your vaccines. And they're coming, I promise. They are coming. But it's not that your lives don't matter. It's that, we've got to keep society running. And in order to make sure that people that are able to isolate have services and have the ability to continue to isolate, we need to keep certain things running. So if that makes sense, it's not that we're trying to get the vaccines that are limited to, people that just don't matter. They're fine, but it's to try to make sure that they don't call out so that, services are limited. It's to make sure there's services to provide. So that is the triage system. The final thought is what's going on in LA. I've seen a lot of people sharing this about LA no longer transporting cardiac arrests to the hospital. This isn't new, guys. This is something that has been going on in the United States in multiple services in multiple states for a very long time. So I want to explain this a little bit further. Not every cardiac arrest is going to survive. I feel like that's self-explanatory. In certain cases, CPR will not be started. Now, here's why. And this is probably going to be really, really common sense. If you show up to a scene and somebody is decapitated, you can do all the CPR in the world. You will not bring them back. If you show up to a scene and the house is burnt down and the person is burnt completely to a crisp, you will not bring them back. If you show up to a scene and somebody has been in cardiac arrest for 10, 15, 20 minutes and has not had any CPR, more than likely they will not survive. For every minute that somebody does not have compressions, their likelihood for survival is very, very slim. It actually kind of decreases, and this is where the science kind of gets, I think, mucky, anywhere from, 7 to 8%. Some papers say 10% every minute. So by 10% or 10 minutes down with no compressions, that means getting oxygen to the brain and the heart and other vital organs. By 10 minutes, there's just no coming back in some cases. Now, there are some cases like hypothermia and a couple other cases that's not the case. And, those cases are exceptional. But those cases will not be worked. And when you look at just the headline of these news outlets, you don't get that. So I really caution you guys to please, take this with a grain of salt. Please read the article. Please read the guidelines. LA is in such a strait where they are waiting ambulances outside 4, 6, 8 hours. Now, consider if a person is in cardiac arrest. They often need to be cooled to preserve neurological function. This decreases the metabolism and a large amount of pathology I probably can't explain. They probably need a lot of oxygen, more oxygen than ambulance has, and there's a huge oxygen shortage right now in LA. Resources. When somebody has a very, very low survival rate, and you have people there that are much higher and viable, this is called triage. And right now we're in a pandemic because a lot of people didn't listen. And it's not punitive. It's not punitive. It's called triage. This comes from war. Triage means to sort. So what happens is we reprioritize our resources to people that can be saved. When somebody's in cardiac arrest, their likelihood of surviving is not good. So when you have people that need oxygen and need services, but you have ambulances that are sitting for 4 to 8 hours with people that are unlikely to survive, you've now taken away 911 units from people that are. So before you cast stones, please read about it, please ask about it, and please ask how you would feel if you knew that you were not getting an ambulance and your life could be saved because you knew that somebody who could not be saved. I ask you to show compassion, but I also ask you to show our understanding. The science just isn't there. It's not new, and it's not that people are being heartless. It's just trying to save lives, as many as possible. So that's all I'm going to say. As always, if anyone has questions on anything, I'm happy to answer. This is a lot longer than I anticipated. I'm really sorry about that. But I will update you tomorrow, and I hope everyone stays well, and let me know how your vaccines are going. Thanks.